title of our today lecture or session is antiviral drugs. So first of all, before the start of our topic, unfortunately, I want to tell you that the second wave of corona, COVID-19, it has been started in most of the countries. So be careful, wear your face mask while you are going outside, maintain social distancing, always wash your hand when you are coming or going at the home, and also be careful when you are meeting with the people. And remember that still there is no drug of choice to treat the COVID-19. All over the world, people, the scientists, they are working for the development and design of some type of the vaccines. So viral, you can say, infection as such or itself, they are very dangerous. And if you see all over the world now, nowadays, sorry, we are facing a lot of viral infections all over the world. And if you see, first of all, like hepatitis B and hepatitis C, and in the latest year, like Ebola, Zika, and MERS, all these are the viral infections. And unfortunately, if you see that almost from all these infections, some are the endemics, some were the endemics. A lot of people have been disturbed, a lot of people have been killed, and most of the infections, they are still persisting. Things like hepatitis B, even we have the vaccine, but a lot of people, around about 230 million people in the world, they are affecting from hepatitis B. And similar is the case with hepatitis C, that 71 million people all over the world, they are infecting with hepatitis C virus. HIV as well, you can say. So what it means, that means the why the viral infections, they are persisting as compared to the bacterial infections or the fungal infections. So there are a lot of reasons, you can say that. First of all, the viruses itself. The problem with the viruses is that viruses, we cannot categorize that either they are the living or the non-living organisms. They are the very, very small organisms, and they can persist in our body for a long time. Means even we have some type of drugs to cure or treat some type of the viral infections, but most of them, they can persist in the body for a long time, even we have some type of treatment or cure for some time, you can say that. Second big thing is that the virus, they can mutate, they can change their genome, DNA or RNA, very quickly. It means that they have a lot of strains, they have a lot of types, and they have some type of drugs. Some type of the drugs, they are effective to one strain or one type of the viruses. But after some time, after some years, you can say that, like MERS, you can say. MERS, it was first started in China in 2003, but after that it came into the Middle East in 2013 or 14. And now we are also the same problem, that this MERS virus, which is actually a MERS virus, SARS-CoV-2, it is actually has spread all over the world. This COVID-19 virus, you can say that it belongs to the same family where we have been suffered from the MERS one sorry, SARS one, as well as the MERS in the Middle East. So it means that there is something in the viruses, means they can mutate or change their structure after some years, and then ultimately they have the different type of infections, capacity, and the categories. And the second important thing is as well, I can give you a very simple example like influenza vaccine, or you can say that influenza virus, which actually caused the flu, seasonal flu. So seasonal flu virus, it has a lot of strains, it has a lot of types. So it means that virus, it actually mutates or change their genome after some time, means 5 years, 10 years, and then ultimately they cause more severe infection, as well as you can see that a chain of infection. So everybody is clear that this is just a preamble or some type of the introductory words, that you must know that why we are actually discussing the viral antiviral drugs. So first of all, if we see in this our topic, there are something which I must want to tell you, that what are the objectives of our this topic. I think this session is both for male or female, both for male and female. So first of all, learning objectives. If we see the learning objectives by the end of this session, you should be able to correlate the antiviral main mechanism of action with viral replication. So this is the first aims or objective of this session. What it means that? It means that most of the antiviral drugs, yes, there is one from Dr. Ibrahim and one from me. I'm not sure that means either Dr. Ibrahim is for male or I am for the male or female. I don't know exactly. I am so sorry that. So if we see the drug mechanism of action, especially for the antivirals, so most of the antivirals, they actually stop the virus replication. Means when the virus, it actually uh, make a copy, a lot of copies of its DNA or RNA, most of the antiviral drugs, they actually stop, inhibit or block the viral replication. The first aims and objective of our today's session is that how you will correlate or link the antiviral main mechanism of action with the viral replication. Second, identify antiviral treatment of common viral infections. As I explained you earlier, that we have influenza, we have herpes, and we have the hepatitis. So these are the big viruses which have almost infected most people in the world, like influenza, herpes, and the hepatitis. And the third is the outline the main mechanism of action of antiretroviral drugs and their clinical use in the treatment of HIV infections. Means AIDS, you can say that HIV infection, it is also causing a lot of problems all over the world because a lot of people, you can say, specifically in the developed world and even the Africa, they are suffering from this HIV infection. So all these three are the main aims and objectives of our session. So first of all, if we see the outlines of our today session, the virion structure and viral replication. So what are the outlines of today's session is that first we will discuss that what are the actually virus structures. When we say the word virion, it means that the infectious viruses. It means that the infected virus structure, and the virus replication means how the viruses they make a copy of their DNA or RNA. So first we will see that what are actually the viruses, what is their chemical structure. There you can see that chemical composition as well as how they replicate their DNA or RNA or make a copy of their DNA and RNA. Then we have the drugs for herpes virus infections. Then we have drugs for influenza. Then we have drugs for hepatitis. Then we have some type of the anti-HIV drugs. So first of all, if we see that the antiviral drugs, first I will let you know that what is actually the chemical composition or the structural composition of a virus. If you see this diagram, this is a very simple diagram, and this simple diagram, it lets you know that what is actually a virus consists of. Just a minute. Hello. Yes, welcome, sir. Yes. Uh, just a minute, doctor. I'm so sorry that I did not see the schedule. But if I see that, no, actually, yes, yeah, Dr. Hala, sorry, Dr. Allah, he told me the female ones. The females are with me, I think. Yeah. Yes, because if you see the schedule, it is not written that it is written that antiviral drugs, Dr. Ibrahim and Dr. Imran, but they did not mention that either it is male or female. No, no, I did not write the mail. I write the mail for me because last time there was a message from Dr. Hala, I think, that you have to write the male or female. Yes, yes, yeah. Okay, okay, that's fine. Yeah, I'm so sorry. Yeah, last time, Yes, but last time, Dr. Hala, it was mixed. You can say that the module A it was mixed, male or female. But the module B, I am not sure that because they did not mention in the schedule even that either it's male or female to me or Dr. Ibrahim. Yeah, but in the first module A, me it was with the male and female both. It was mixed. Yeah, female. Yeah, I'm teaching the females because most of the females they have joined the session. Yeah. And even some males are there. I don't know because the schedule which is sending to me it does not indicate anything. Means either male or female. Yeah. Yes. Yeah. Yes. Yeah. Yeah. Yes. This is a mistake. I think this is a mistake, and I think Dr. Allah she can explain you better. Yeah. Yeah. Yes. Yeah. Thank you. Thank you. I'm so sorry because there was some confusion that we will teach to which one. So first of all, if you see this uh, diagram, it tells you that what is actually a virus. So all the viruses, you can say that they have this general diagram, composition, chemical, or the structural composition. But there is some difference, you can say that at the molecular level, or you can say that at their chemistry level. But mostly a virus, it consists of, yes, maybe the males, I think they have to go with Dr. Ibrahim, if I'm not wrong. And the females, they have to be with me. I'm so sorry because there is some confusion. So everybody's with me on the female side. Can you hear me? Okay. So if you see the structure of a virus, so if you see that there are some basic components like nucleic acid, it is DNA or RNA, it is present in every virus. Then we have a capsular envelope, means this DNA or RNA, it is covered by some type of the capsules or envelope proteins. And then the virus, it has a coat, a core protein, and then there are some embedded proteins. These embedded proteins, they actually bind to the host cell and they have to penetrate, they have to target some host cell, enter into the host cell, and then cause the infection. So you see that almost all viruses, they have these three or four structures common in all their chemical, or you can say that the structural compositions. So if we see that, first of all, the viruses, they are the obligate intracellular parasites. When we say the words obligate intracellular parasites, it means that these are actually the organisms, the not the microorganisms, these are organisms which actually need the host cell to survive. Means they actually enter into the host cell and they hijack, they take the control of all the machinery of the host cell to produce themselves, to make a copy of their DNA, RNA, and to make a duplication of their number. They double their numbers, or you can say that they increase their generations into the host cells. And they depend on the infected cells for their growth and replication. Growth means they replicate, make a copy of their, you can say that DNA or RNA, and ultimately they make a growth, means they are making from 1 to 2 viruses, 2 to 4, and etc. And in many viral infections, replication of virus peaks before manifestations of clinical disease. This is very important that whenever someone is infected with a viral infection, means either it is hepatitis B, either it is hepatitis C, or either you can say that some type of simplex virus, HIV, most of the viruses, they first of all replicate to increase their number before the start of the infection. Either it is acute infection or either it is a chronic infection. What it means that? It means that when a virus, it has to produce a chronic or acute infection, they actually replicate their DNA or RNA just to, you can say that, infect the host cell to produce some sign and symptoms of that particular disease. This is very important. Is there any question from anyone? Because they are writing in Arabic. I'm not sure that. So every virus, when it has to produce an infection, it must has to increase its replication or increase the number of its DNA or RNA and growth as well. So effective treatment will depend on either early initiation of therapy or prevention of infection. So what it means that when a virus produces an infection, it replicates its DNA or RNA as well as its growth. So what it means that when you have to start a therapy, you must have to start the therapy in the early initiation of the infection. Means when there are early signs and symptoms of a viral infection, you must start the therapy of that viral infection. Or you can use some of the prophylactic vaccines like HBV, hepatitis B. We have a vaccine. So everybody must get the vaccination for the hepatitis B just to reduce or prevent the infection of hepatitis B virus. But if someone has get infected, then ultimately in the acute infection, if you want to treat that guy or that girl, then ultimately it is actually useful that you start the treatment in the early stage of infection, either in the acute stage where the signs and symptoms they are mild. They are mild signs and symptoms or the start of the symptoms. So this is actually, you can say that simple structure of in this slide. There is a small structure of the virus. What are the viruses actually, and what actually the treatment usefulness when you are using some type of the drugs. So second, if we see in the next slide that how viruses they actually cause replication and their mechanism of antiviral drugs. So first of all, if you see in this diagram, this is a virus. So first of all, the virus, as I told you, that they have some type of the enveloped proteins. When a virus is attached to a host cell, these proteins they are actually make a contact with the host cell. This step is called actually the binding. After that, when the virus it binds to the host cell, the nucleocapsid with the DNA or RNA, it goes into the inside the cell. This is called actually the penetration or fusion. When it goes inside the host cell, then this nucleocapsid or capsular protein, you can say that it's degraded, and DNA or RNA it becomes free into the host cell. This is called actually the uncoating. And this nucleic acid, you can say that either it is RNA or DNA, it actually starts the replication. It replicates, and ultimately it will produce the proteins. Either it is the nucleocapsid proteins or either the envelope proteins. This is called actually the protein synthesis. After that, there is some viral maturation inside the host cell with some host proteins. This is called maturation, and at the end, it releases from the host cell to produce more viruses and start of the infection, either it is acute or the chronic infection. So first of all, if we see that how many type of the antiviral drugs and how they act on the life cycle. This is actually a life cycle of a virus when it has to produce an acute or the chronic infection. So first of all, antiviral agents act on the viral replication cycle. So most of the antiviral drugs which we are using nowadays, either it is for influenza virus, either it is for hepatitis B virus, either it is for HCV virus, either it is for HIV virus. Mostly they actually act on this stage. They actually prevent or stop or block the replication of the viruses. Means decrease, block, or inhibit the nucleic acid synthesis of the viruses. Because when there is a nucleic acid synthesis, then ultimately there are a lot of proteins virus they produce, and there are a lot of viruses they mature, and ultimately their number, and you can say that the replication is increased. So first of all, antiviral agents they act on the viral replication cycle. Means here they most of the drugs they act on this, you can say that side. What they do actually, we see that the mechanism of antiviral agents, generally, they inhibit penetration and uncoating of viruses into host cell. There are some drugs which will act only this part. Means when the virus it acts, it makes a connection with the host cell. Penetration or uncoating. These two steps. One is the binding, penetration. And we have some examples like immunoglobulin and the interferons. Then we have some of the drugs. They actually inhibit the synthesis of the viral nucleic acid. But most of the drugs, antiviral drugs, which we are using nowadays, they are acting on this step, like acyclovir and the genciclovir. Then we have some drugs which actually inhibit the assembly and release of new viruses from the host cells, like this step. Means when the viruses they are matured and they actually are releasing to infect most host cells. And ultimately, we have some drugs which actually inhibit the release of the mature viruses from one host cell to infect the other cells. And we have an example of oseltamivir. And then there are some immune modulators like interferons, which actually strong our host cells that they can kill the viruses outside and they cannot allow the viruses to enter in the host cell. There are a lot of type of interferons, but mostly we have interferon alpha, interferon beta, interferon gamma. There are a lot of interferons, but mostly for the treatment of hepatitis viruses, you can say that we are using interferon beta, interferon alpha both. There are even interferon lambda as well, but mostly interferon alpha and beta they are mostly used for the treatment of the viral infections. So everybody is clear that what are the viruses, what is their life cycles, and how many type of the mechanism of antiviral drugs. So then if we come towards the principle of the antiviral therapy. So the first thing is that, as I told you in my preamble or the introduction, that what are the difficulties in developing antiviral agents. There are some difficulties. What is actually the difficulties? The first difficulty is in obtaining selective toxicity against viruses. What is selective toxicity? Like if you see that if you are using some so Miss Asma, what you did not get it, please explain so that I can explain you. There is some question from one student that she did not get it. So last one, okay. So if we come towards the previous slide, yes. So I told you that this is a life cycle of a virus. Life cycle of virus means that when a virus it infects a host cell. So first of all, the enveloped proteins of the virus they make a connection with the host cell. This is all is a host cell. This all is a host cell. This one you can say that. After that, the DNA or RNA of the virus it penetrates into the host cell with the nucleocapsid protein. This is a nucleic acid proteins which actually protect the DNA or RNA of the virus. When it goes inside, and ultimately this nucleocapsid protein it is broken and the DNA or RNA of the virus it actually releases into the host cell. So the last sentence I told you that immunomodulators is asthma. Immunomodulators are the drugs like interferons which actually stimulate or boost your immunity. Just like you can say that this COVID-19, very good example. Till now, we don't have any drug for COVID-19 treatment. So what the doctors, the physicians or the clinicians do, clinicians, physicians or the doctors, they are actually injecting the infected persons with some of the immune modulators, immune boosters like interferons, cytokines, you can say, just to increase the immunity of the host cell that they can easily target, they can easily destroy the viruses outside until they enter into the cell and cause the infection of the cells. I can give you an example. If that there are a lot of our immune cells in the body. Maybe in immunology, someone told you, some of the doctors explained you that we have beta lymphocytes, we have T cells. Okay, so T cells they actually become very strong when we have some type of the interferons because they have CD4 cells, they have CD8 cells, which natural killer cells. There are a lot of cells, immune cells, in our body, lymphocytes. You can say that there are some monocytes. All these are the immune cells. When we inject some of the interferons, and ultimately those cells, they become strong. Their production, it is increased, you can say, and ultimately they kill the virus in the blood and don't allow them to enter into the host cells to infect the host cells and then ultimately cause the acute or the chronic infection. The more you can clear, like COVID-19 virus, it infects the lung cells, okay? But if a person, he has a very strong immunity, then ultimately the lymphocytes, monocytes, they cannot allow the virus to enter into the host lung cells. And ultimately, you can say that the virus, it can be cleared and the person, he may prevent from the infection. But it depends on the immunity of the system. In the COVID-19, a lot of doctors, they are stressing that please boost your immunity with vitamin C, some type of zinc supplements, you can say that, like vitamin A. So what it means that? It means that they actually protect your host cells that don't make a combination with the virus cells, while the other natural killer cells or the immune cells like T lymphocytes, monocytes, or some macrophages to kill the viruses outside the cell so that they cannot infect your lungs cells, and then ultimately the virus, it can be destroyed, or you can say that it cannot even cause the infection. Everybody is clear? Yes, there are some type of the immunoglobulins like A, there are E, lot of immunoglobulins, but here interferon does not affect the immunoglobulins or like IgA, IgE, or G. No, they actually boost your natural killer cells, T lymphocytes, monocytes, neutrophils, just to kill the viruses. Then we are coming towards the next slide, which I told you that the antiviral drugs, that principle of antiviral therapy. So if you see, there are the challenges in the antiviral agents, developing or design of the antiviral agents, you can say that, or the drugs. What are those challenges? The first challenge is that difficulty in obtaining selective toxicity against viruses. What it means that? It means that I can give you an example for bacteria. Like for gram-positive bacteria, you know that there are some specific beta-lactam antibiotics which are only effective against gram-positive bacteria. Means the infection in your upper respiratory tract, like pharyngitis, like this and that. But they are not effective against the gram-negative bacteria. So it means that the bacterial or the antibacterial agents or the antibiotics, they have some type of the selective toxicity. But this, it cannot be achieved or difficult to achieve in the viruses, because the viruses, they are very, very small than the bacteria. This is the first. And second thing is that the bacteria, they actually have a more replication, more duplication of their genome as well as their number. They, you can say that, replicate and increase their production very, very quickly as compared to the viruses, the bacterial, sorry. So this is the second reason. The third big reason is that the viruses, they can mutate very quickly. They change their shape and chemical structure of DNA very quickly. Like I can give you an example. If you see that this influenza virus, it was started 1918 or before that, okay? It was at that time called H1N1. But if you see that now, a lot of types of influenza viruses, it has been all over the world. What it means that the viruses, it has mutated or changed their chemical structure, their structural composition, as well as their DNA or the RNA. It's called the mutation. So virus, they can mutate very rapidly. If we compare the bacteria and the viruses, they can mutate very rapidly, and this is the reason that why we don't have any, you can say that, selective toxicity against the viruses. This is a big problem, you can say that. And if you see this sentence, is very important, that no therapies have been shown effective to date on the pharmacological treatment of COVID-19. Why? Because if you see that when the COVID-19 it was started, most of the people at that time, it was saying that maybe the virus, it will not mutate. But unfortunately, if you see that now in the second wave, the virus, it has been changed. And if you see in the second wave in Spain, in UK, in the Western world, it is affecting more people. Because first it was saying that there is no change in the virus, but now the scientists, they are saying that it has changed its shape, it has changed its DNA or RNA to somehow. So what it means that, the the scientists, they were discovering the vaccines or the drugs for the first virus. But now there is some change. Then ultimately, this is the second big problem for the scientists now, that how they will develop the drugs, or maybe the drugs which were developed for the first one, or the vaccine for the first type of virus, maybe it will not effective for the second type of the virus. So this is a big problem, you can say that. And this is the reasons that why I am letting you know that history repeats itself. There is some English phrase, history repeat itself, but don't try to make the history repeat itself, because if you remember that in 1918 there was Spanish flu, and Spanish flu, it kills more than 50 million pupils. And if you read the history of that Spanish flu in 1918, the first wave, it was killed just only 5 million people. Just imagine the difference. The first wave, it only killed 5 million people. After that, when there was a second wave, before the period between first wave and the second wave, people, they don't care. They did not wear the masks. They did not measure the social distancing. They did not go for the preventions. And then ultimately in the second wave, you imagine that how many people they die? 50 million. Just imagine how many people die? 50 million the second wave. And maybe may Allah not accept my words. The same is the world facing now for the second wave of the COVID-19. The virus, it is attacking more people very vigorously. The signs and symptoms, they are more severe, and it is persisting. The main important thing is that it is persisting. It is not going as compared to the first wave, sorry. So be careful that the second wave, it is more dangerous. In the Western world, in the USA, it has been already started. So whenever you are going outside, traveling outside the country, very carefully you have to do these things, these steps. So everybody is here still now. Our preamble for this viruses, some useful facts for you people. What are the virus structure? What are their replication? What are their you can say mechanism of action of antiviral drugs? Because next we will start our antiviral drugs. Any questions till now? I am here. Okay, so there is no question. Huh? So first of all, we will start the drugs for herpes virus infections. Now this is very interesting for you people, that if you see herpes virus infection, so just imagine that there are two types of herpes viruses. Maybe in some virology lecture you have already someone told you. One is HSV1 and the other HSV2. So HSV1, it is mainly transmitted from oral to oral contact, cause some type of the oral herpes. It is also called sometimes cold sores, you can say that, on the lips. You can say that sometimes you have blisters. Even on the skins, you can say that, in the mouth. It's called actually the HSV1 or the oral herpes. But they can also cause some genital herpes. HSV is a sexually transmitted infection, and it actually infects the genital herpes, both in male and female. And both viruses, they are HSV1 and HSV2, they are the lifelong. And specifically in the Western world, developed countries, would you imagine that 3.7 billion people under the age of 50, they have HSV1 infection globally, all over the world. There are 3.7 billion people all over the world which has HSV1 infection. Means it actually affects your skin mostly. But if you imagine that the HSV2 is in the Western world or developed world, the people, they don't care about their sexual contacts by any means. 491 million people. Would you imagine that 491 million people in the worldwide is mostly in the Western world, and in the USA, or you can say that in the South America, or you can North America, they are suffering from this HSV2 infection. And both these are asymptomatic. Most of them, they don't know, and this is a very big problem with the viral diseases. Like suppose in COVID-19, most of the people in some part of the countries like Pakistan, India, and Bangladesh, they don't know that either they are suffering from COVID-19 in the first wave because it was asymptomatic, and this happens with some type of the viral infection. That some type of the viral infections, they are asymptomatic in the start of their you can say the infection in acute stage, you can say that. So just imagine that how much the HSV infections they are dangerous for the human health, and mostly they are asymptomatic and they are contagious, means they can transmit to other people. And here is one confusion, when the people they say the word contagious, they say that if a person is infected. No, even a person, he has the virus in his body, in his or her body, okay, maybe the symptoms are present or not, he or she can infect other one if it is a contagious virus, like in COVID-19. Some cases it has been reported that the people they don't have the symptoms of virus COVID-19, but when they tested, they have the virus COVID-19. So it means that they actually transmit the virus to the other people. Either they don't have the symptoms. So please, this is my stress, that please be careful that while you are make a contact with anyone, social distancing, maintain social distancing, because most of the cases of COVID-19 they are still asymptomatic, but the person they are suffering from the COVID-19, the virus is inside their body and it's a contagious virus. So first of all, if we see the antiviral drugs, we will discuss about the herpes virus infection, and I have given you some introduction of the herpes virus infections. And herpes simplex virus, there are three categories of the herpes viruses. One is the herpes simplex virus, HSV. There is varicella zoster virus, and then is the cytomegalovirus. So all they are the herpes viruses. If we see that the first herpes simplex viruses, there are three examples: herpes labillus, genitalis, and hepatic encephalitis. Herpes labillus means mostly the females they are infected. Sometimes the females on their lips, they have some type of the blisters on their skins. These are actually the herpes labillus infection. If you see here, this guy, he has some type of the blisters on his lips, you can say that. Herpes genitalis, as I told you, that most of the sexually transmitted blisters on the male and female part of the genitalia of the reproductive organs. And hepatic encephalitis means some of the newborn babies, means the female specifically. This is also very important that females who are in their reproductive age, they must have to go for the torch test. And you know that the torch test is actually a toxoplasma, rubella, cytomegalovirus, and HIV test. So most of the cytomegalovirus actually cause the herpetic encephalitis, means the cerebellum of the newborn baby, they are mentally retarded. They cannot produce their function, you can say that. Then we have the varicella zoster infections. They are the chicken pox and shingles. And what are the shingles? That means you have some type of the blisters at any part of your, maybe at the sternum, maybe at the back side of your body. There are some type of the blisters with some type of the mucus, and ultimately when you scratch it, ultimately you feel the pain. And there are some cytomegalovirus, as I told you, that it can damage the retinitis, means the retina, inflammation of the retina, esophagitis, and the colitis, means they can damage your esophagus as well as the colon. So if we see the drugs for these herpes viruses infections, there are two types of drugs. Two examples of the drugs. One is acyclovir and the other is the genciclovir, and they are the nucleic acid synthesis inhibitor, means they actually decrease, inhibit, or block the production of the nucleic acid, replication of the DNA or the RNA. Everybody is clear? Everybody is following? Okay, that's fine. So there are two types of drugs. One is the acyclovir and other is the genciclovir. So if we see their mechanism of action, they are actually the nucleoside analogs. What it means, that means the structure of this acyclovir and the genciclovir, it actually resembles, it is similar to the chemical composition of the DNA or RNA of the virus. And ultimately, they inhibit viral DNA polymerase enzyme, which replicate the DNA or RNA virus. Means the enzyme, they actually make one copy of DNA to two to four, like this and that. So these drugs, they actually inhibit the synthesis of this nucleic acid. And there are two type of drugs, or two you can say that example in this herpes virus infection drugs. Acyclovir, it is effective in the treatment of various HSV and VZV infections. It is available in the form of oral, intravenous, topical use. And the Genciclovir, it is administered most of the time orally or intravenous. And it is effective for the cytomegalovirus infections in immune compromised people. The pupil, some type of the pupil means, or some babies when they born, they have continuous diarrhea, or chronic diarrhea. It is actually due to this cytomegalovirus infection. So at that time, we have to use some type of the antiviral drugs or the viral diarrhea. Maybe you have listened this term, viral diarrhea. In the newborn, they have that type of the chronic diarrhea. Ultimately, they are immune compromised, means their immune system, it is not working well. So they have this type of the viral diarrhea. So for the treatment of that viral diarrhea, which is due to the CMV infection, we are using the Genciclovir. So there are two type of drugs. One is Acyclovir and the other is Genciclovir, which are used against the herpes virus infections. So everybody is clear about the herpes virus infections and their treatment. Okay. Then we have the drug for influenza. So first of all, if we go for the influenza, this I am telling you. Let's just see that in 1889, this was the start of this influenza, or you can say the flu, seasonal flu. Just imagine. Yes, Mr. Ali, you can, viral diarrhea means, just for your information or knowledge, but the main emphasis of the this session, it is the antiviral drugs. You must have to know the drugs which are used for the treatment of some type of the viral infections. The viral diarrhea, I just give you as an information. So information does not mean that it will come into the exam. Don't worry about the exam, that everything which I am speaking, it may be coming to the exam. So you see that the influenza, in slide 7, yeah, means herpes simplex virus. As I told you that when we are coming for the treatment, there is a question from some student. Yes, for the HSV infection, mostly acyclovir is you can say that used, but even you can use the Genciclovir as well, because we don't know that which type of infection, herpes virus infection, has been caused by which type of virus. This is a problem. So most of the acyclovir and Genciclovir, both you can use in any type of the herpes virus infection. Either it is due to the HSV1, HSV2, or either you can say that it is from some type of cytomegalovirus or the varicella zoster virus. But some of the antiviral, they have the some specificity or some select, like acyclovir. They are mostly used for HSV1 infection or the cold sores, you can say that. And the other ones, they are used for the cytomegalovirus virus or some type of other viral infections. So this is my, you can say that saying to you that just imagine that starting from 1895, this influenza virus, now in 2015 or 2019, there are how many viruses they have changed their shape. The virus is similar, but there are so many forms of the viruses due to the replication and also the change in the proteins which are on the surface of the viruses. So this is very important, that remember that when a virus, it mutates, it is more dangerous. When a virus, it mutates, it is more dangerous. I can give you an example here, like hepatitis C virus. We don't have any vaccine for hepatitis C virus till now. And just imagine that how many types of the virus HCV, there are 7 genotypes and maybe 67 subgenotypes. Just imagine, and more all over the world. Although we know about drugs, but ultimately the problem is selectivity. Some drugs, they are effective for some types of HCV, but not to the others. And same is the problem with the influenza, that we have a lot of types or strain of the influenza viruses nowadays, starting from 1895 to 2015. But mostly you can say that they have changed their shape. So ultimately, this is a problem. When a virus, it's changed its shape, it's changed its nucleic acid, and ultimately you have to design more drugs or develop more vaccines. And we are facing this problem with the COVID-19. In the scientists, they started for the vaccine for the first wave virus. Now it has been changed, and ultimately they have to develop new vaccine or new drugs for the second wave virus. So this is a problem with the viruses, that we don't have any selective toxicity of the antiviral drugs for the viruses. So first of all, if we see the influenza, it is a seasonal respiratory infection caused by influenza type A and type B viruses. So there are two types of the influenza A and B viruses. And if you see that, what is the difference between these two viruses, influenza A and B? Mostly the type B flu, it is found in humans. Here, so most of the influenza virus in humans, it is type B, and it may cause severe reaction than type A flu virus, but occasionally it is more harmful. Means type B influenza virus, it slowly, you can say, that cause the reaction or the infection, but it is more dangerous than the type A flu virus. Second big difference is that B type influenza virus is not classified into subtypes, but A, it has a lot of subtypes, you can say that. Maybe you can say A1, A2, A3. So most of, you can say that type B influenza virus, they are not pandemic. They don't cause the pandemic. Means you saw the seasonal flu. Like in Saudi Arabia now, this is a period of seasonal flu. So everybody is getting the flu shot in October or November. Here, but in some other part of the world, like in the USA or in the Europe, maybe it is in January or February, maybe in the start of September or August, and you can see that there is a seasonal flu. So it actually do not cause the pandemic, because it is not all over the world. Type B viruses, you can say that. But if we see the type A influenza, they can cause some type of the outbreaks every year, you can say that, and cause the more infection to the people. But mostly type B influenza virus, they are more severe in reaction, but they don't cause the pandemic. So everybody is clear between the difference of type A and type B viruses? Yes, type A, HN, both they are HN, but if you see that the difference, that how many HN has been changed now from 1895 to 2015. Both they are type 1 or type B, so type A or type B, they are the HN infection. But my point is that type A viruses, they can spread an outbreak, but type B, they are the natural host of the human. They are more severe. Type B viruses, they are more severe because the human, they can survive this virus for a long time. This type B viruses, type B flu viruses, human can persist a long time. And remember one thing more, as I told you that Alhamdulillah, you have a 10 or 12 year experience on the virus research. Remember one thing in your life. This is a clinical part for all you people. A virus never dies. When it infects a human, it never dies. It may persist in your body for a long time. So a virus never dies in your body. It may persist for a long time in your body. And this is the reason that why you see that people, they get reinfection, like flu. Every year we have a flu for some pupils. Majority of the pupils who are get infected with this influenza, like HCV or HBV, hepatitis B or hepatitis C infection. The people who have the hepatitis B or hepatitis C infection at any stage in their life, if they don't use any precautionary measure, it may reinfect them. So a virus, it may never die. Remember that. And this is the reason that why I always stress upon that. Please, please be aware of the viral infections. They are more dangerous than any other infection in the world. So hand washing and influenza vaccines are the primary means of prevention for the influenza. Treatment is primarily supportive, as I told you, because the virus, it may change itself after 1 year, 2 years, 3 years. And ultimately, you can say that every year you have to go for the influenza flu shot vaccine. So everybody is clear? Then we have some drugs for influenza, amantadine and oseltamivir. So amantadine actually prevent uncoating of influenza A virus. Means it actually acts on the step 1. when the virus, it goes inside the host cell and start to uncoating of the virus to release the nucleic acid into the, or the DNA into the host cell to replicate. So it is used as a prophylaxis against influenza A virus infection, and mostly you can say that it can reduce the symptoms if you give within 48 hours after contact. When you are using the Mentadine, it may effective within 48 hours just to relieve the silent symptoms of the influenza A virus. So mostly you can say that is effective against the Mentadine. Everybody is following me? Yes, this is a very good question, is that how they can make the vaccines more rapidly if the virus mutates very quickly. This is a very important question. You know, some of the viruses, even they mutate, but we know their exact chemical structure, their chemical composition, and their life cycle, how they infect the body. This is very important. It's a very good question, and I appreciate that guy. Means he asked a very good question, is that if the virus mutates so rapidly like influenza, how we can prepare the vaccines more rapidly as compared to the COVID-19. And this is an example of very genius students. Like in COVID-19, what is the problem actually? Why we don't have any vaccine still now for the COVID-19? Because we don't know that how actually virus infects the lungs. What is the life cycle of the virus? In the case of influenza, we know that we see the influenza virus, so that how virus it infects or damages the host cells. In the case of COVID-19, hepatitis C, we don't know that what is the life cycle of the virus, how it actually infects the host cells. Some steps we know, but most of the steps we don't know. So it means that to prepare a vaccine, to prepare effective vaccines, you must know the life cycle of the virus, that how it actually affects the host cells to produce the infection. This is a very good question. For the development and design of vaccine, you must know the full life cycle of the virus. For the influenza, hepatitis B, we know that how they actually infect the host cells. So ultimately, we have the vaccines. But for the hepatitis C, for hepatitis C, COVID-19, for HIV, for Zika, we don't have the vaccine. There, so this is very important that whenever you are going for the design of a vaccine, the drugs, or the viral infections, you must know that the complete life cycle of the virus, how it actually infects the human body or the host cells to produce acute or the chronic infections. It's clear? So then we have the oseltamivir. Yes, the second point is that I told you that whenever you have to design or develop the vaccine for the viral infections, just imagine that, can anybody know any bacterial infection that we don't have any vaccine? For every almost bacterial infection, we have the vaccine. What is the reason that? The reason is that, first of all, the bacteria, they are more larger than the virus. We know their life cycle, that how they infect the human body. But the viruses, they are very, very small. They can mutate very rapidly. We don't know exact life cycle of their viruses. As I have given you the example of COVID-19, HCV. We don't know that how the viruses, they actually infect the host to produce the acute or the chronic infections. So when we don't know that how they actually infect the human bodies, the mechanism, then ultimately it's a problem to create or produce the vaccine. The second drug is the oseltamivir. It actually inhibits both influenza A and B viruses, neuraminidase, and activity that is essential for viral release and spread within the respiratory tract. So they actually cause the inhibition of this enzyme, which actually allow the virus to spread into the respiratory tract and cause the infection. So it is effective both for prevention and yes, the tuberculosis, even for the tuberculosis, nowadays we have the vaccine for the TB. It's a bacterial infection. But I am letting you know that for most of the viral infections, we don't have the vaccines. So everybody is clear about the influenza drugs? Any question? When we have drugs for hepatitis, So first of all, this is my topic of interest because I have a research on hepatitis C virus, and alhamdulillah, I have a good number of publication as well as a book on the hepatitis C virus infection. First of all, hepatitis B infection. It is spread by contact with body fluids from an infected person, such as blood and semen. So this is the reasons that why most of the hepatitis B viruses, they are actually a problem. They can spread by infected person, body fluids, blood, or the semen. Both, you can say that. Either it is a blood to blood contact, or it is a sexual contact. The infection may be either acute and self-limiting or chronic. Both may happen, acute and chronic. And second big problem, I am letting you know, when that guy he has a question. Remember that whenever one is suffering from any type of viral infection, either it is acute or chronic, he or she cannot use the vaccine. We don't have the protective vaccine still for any type of a viral infection except the influenza or HSV, like hepatitis B, hepatitis C. If someone is suffering, we cannot use the vaccines, protective vaccines. They are the prophylactic vaccines. There, for HBV, we have the prophylactic vaccines. We don't have the protective vaccines. There are two types of the vaccines. I think I have a very short time to cover this lecture. Inshallah, if I have a chance to use for some other session, I will let you know in the detail because this is my research field. So protective vaccines, it is very, very limited for the viral infections. We have prophylactic vaccines for the hepatitis B only, not for hepatitis C even. For A we have, for D we have. Okay. So this is also a big problem that whenever someone is suffering from hepatitis B or C, we don't have to go for the vaccines or protective vaccines. We have to go for some type of the drugs or the treatments. Patients with chronic HBV infection need treatment to prevent cirrhosis and liver cancer. And if someone is suffering from hepatitis B or C and they are not, you can say that, taking the treatment, then ultimately their liver, it may have some cirrhosis or the liver cancer that is called hepatocellular carcinoma. So this is the reason that why most of the people all over the world who are suffering from hepatitis B and hepatitis C infection, they have very, very careful treatment, because if they will not take the treatment properly in time, then ultimately they may have some type of the liver cancer. And the third big reason is that the drugs, antiviral drugs, they are very, very expensive. Like for hepatitis C, just imagine one drug, that is sofosbuvir or Sovaldi. The next you can see slide, I will let you know, it is $1,000 the start. It was discovered 7 or 8 years. It was developed. $1,000 one pill, and $72,000 the whole treatment for 6 months, you can say. So this is the third big reason that why we don't have the treatment for all. It's a very big dilemma for the poor nations, lower middle income countries, that we don't have the antiviral drugs for all. This is the reason that why the viral infections, they are, you can say, spreading more and more in the world. The available antiviral drugs for use in the treatment of HBV are the suppressive, not curative. This is the reasons that why I'm letting you know that for hepatitis B and D, we have only the suppressive drugs. They can suppress the infection. It can appear in any time in their life. After 5 years, not 5 years, sorry, 10 years, 15, 20, means if the person, they will not care, they will not prevent any type of blood to blood or sexual contacts, then ultimately the chances that they may get for reinfection, they are not making the or taking the proper measures. Then we have drugs for hepatitis B. As I told you, that interferon alpha, as I told you that it is the interferon. There was some question as well. It is a cytokine that can increase the of antiviral proteins and promotes formation of natural killer cells. This was my point at that time, that they actually, they are the immune modulators. They enhance the production of natural killer cells of the body to destroy the infected liver cells as well as to destroy the viruses. They are used in chronic HBV as a monotherapy, but in HCV they are used with some type of the drugs like ribavirin, and they are given intravascular or the intramuscular, and they have some type of the other indications in the form of some sarcoma and the papillomas. Kaposi sarcoma, it is a specific type of disease, and you can say that you have some type of the cancer in the skin, lymph nodes, or the other organs of your body. It is mostly a type of cancer. It happens to some type of the skin cancer, which mostly the people, they have purple color of their skin, some type of skin lesions, and ultimately you can say it may widespread into the other parts of the body. So we have another drugs, that's Lamividine. It is also a nucleoside analog reverse transcript inhibitor. It will come into the next HIV. What is actually the reverse transcriptase? I will discuss in detail. It actually inhibits the DNA polymerase enzyme, which actually causes the replication of the nucleic acid of the viruses, and it is used both for hepatitis and HIV. So this is for HBV, but HBV, as I told you, that we have the vaccine. The problem is with hepatitis C. What is the problem with hepatitis C? That it is RNA genome acquired by contact with contaminated blood. So it is mostly spread by the blood. Some people, they say that maybe by the breastfeeding or the sexual contact it may spread. Yes, there are some reported cases, but mostly by the blood. Hepatitis C, it is mostly by the blood. Maybe by dialysis contamination, maybe some type of the blood transfusion, you can say that, some type of, you can say that the cut or injury, and you have a contact with that guy or that girl, then ultimately you have a hepatitis C infection. And if it is not treated, then ultimately it may lead to cirrhosis, liver failure, or the liver cancer. So this is very important. That means hepatitis B and C, if you treat them in timely, it is good. If not, then ultimately it will lead to cirrhosis, liver failure, or liver cancer. In cirrhosis, liver, it becomes scary. It means it starts some type of deformation of liver cells. Liver cells, they reduce or abolish their function, decrease their function. Then ultimately there are liver cancer or the liver failure. The primary goal of drugs used for infection caused by HCV is viral eradication. So most of the drug, as I told you, the example, that is Sovaldi or the Sofosbuvir and Velpatasvir, they actually remove the virus from the body. Means they actually release the virus from the body, but they cannot kill the virus. You can say that. This is very important, that they actually release the virus from the body and acting on the virus to remove it from the body. But as I told you, that HBV or HCV virus, they may persist in the body of the human. They may persist for a long time. So whenever you are going for the hepatitis B or C treatment, ultimately the goal of therapy is the viral eradication. Means the virus clear from the body. So these drugs are called actually the direct acting antivirals. What means that they actually block viral proteins responsible for HCV RNA replication. Everybody is following? Yeah, means removing the virus, you can say that. Okay, viral eradication means that to remove the virus from the body. Okay, but as I told you, that these drugs, they are the supportive therapies. It is a treatment. It is not a cure. Yes, removed. You have to remove the virus. It is the treatment. It is not a cure. There is some difference between the word treatment and cure. When we say that word treatment, it means that to prevent, to suppress, or to some extent you can say that it is the removal of that disease. But cure means 100% clear. Unfortunately, in the case of HCV, HBV, it is not happening 100%. You can say that. First, it may persist. Ultimately, the people who are suffering from HBV or HCV infection, they ultimately have to go for some type of the follow-ups. Even they have no treatment, though no disease, they're cleared by the tests. Ultimately, in their life, for 5 or 10 years, they have to go for the follow-up. Either the virus is not reinfect the body again. So there are two types of the drugs. One is the Sofosbuvir and the Velpatasvir. They have a cure over 90% of patients in 12 to 24 weeks. So most of the HCV drugs, they clear the virus within 12 to 24 of the weeks. We have the anti-HIV drugs, antiretroviral drugs. And if you see that in HIV drugs, this is the virus. Okay, it makes a contact with the host cell, bind it, then fusion. Then this is viral RNA. It will make DNA. You remember that in biochemistry, DNA form the RNA, and then RNA form the protein. When it makes DNA to RNA, it is called transcription. But here it is opposite. Viral RNA, it is making DNA. So it is called the reverse transcription. And this is the most important phenomena in HIV infection. Very, very important phenomena. I explain it once again because I have only 9 minutes to end my session. Normally, orderly, in our cells, DNA make RNA, and RNA makes the protein. Clear? When DNA makes the RNA, it is called only transcription. And RNA to protein, it is called translation. But when someone is infected from HIV virus, what it do? It actually causes the opposite. RNA makes the DNA, and it is called the reverse transcription. And when this DNA is formed, it actually infects or integrate, means it actually take part the human cells DNA. Actually, you can say make a part of the human DNA and control all the activity of the human cells. It produce viral RNA and the proteins, and then ultimately produce a lot of viral proteins. You can say the viruses, HIV viruses, which may affect another host cells. This is all the complete cycle of, you can say, that the HIV viral infection. So if we see that the drugs which are acting on the HIV infection, they are the fusion inhibitor. Means first the drugs, they are inhibit this step. These are called actually CCR5 antagonists. Means receptor. There are some receptor. So we have some drugs which actually inhibit the virus contact with the host cell. Then we have some of the drugs which actually reduce this step or block this step. Means RNA is not converting into the DNA. The third one is that which actually cause the blocking of this step. Means that viral DNA is not a part of the host cell DNA. It is called actually the integrase inhibitors. And then at the end is the when both DNA and RNA make the new HIV viruses. It is called actually the inhibitors of the HIV protease. So all of these are the different types of the drugs which we are using for the treatment of the HIV. So if we see the drug, reverse transcriptase inhibitors, like here, this one means we will discuss this one. Yes, CCR5, it is CC, yes, it is CC45. These are receptors. When the HIV virus, it makes a contact with the host cell, they need this receptor that is called actually CCR45. And when we have a drugs, then ultimately the virus, it will not make a complex with this host cell, and then ultimately the virus cannot affect the host cell. So if we see the antiviral drugs, mostly they are the reverse transcriptase inhibitors. Nucleoside reverse transcriptase inhibitors means the drugs which actually block the viral RNA to make the DNA. So they are competitively inhibit the enzyme that is called a reverse transcriptase and cause termination of viral DNA chain elongation. Reverse transcriptase change viral RNA to DNA as is shown in this diagram. This viral RNA is into the DNA. But these drugs, they actually inhibit this step. So the viral RNA, it cannot make the DNA, and then ultimately there is no more virus. Second is the non-nucleoside. We have the Lamividine and the efavirenz. Both these are the examples of these reverse transcriptase inhibitors. So these actually binds to the reverse transcriptase enzyme, leading to the inactive of this enzyme. There is a question in Arabic, but I cannot understand the Arabic. So please, you have a question in English. So both of these drugs, these actually means reverse transcriptase inhibitors. Generally, they actually inhibit this step, means viral RNA to DNA. They actually inhibit the synthesis of DNA from the viral RNA. Everybody is clear? I'm so sorry that I have very short time, but I think I have explained the things. Okay. So then we have the protease inhibitors, that is the ritonavir and the darunavir. Means they actually, the same mechanism. The first drugs, they have the same mechanism. They actually stop the enzyme that is called reverse transcriptase, which actually convert viral RNA into the DNA. Then we have the protease inhibitors, that is the ritonavir and the darunavir. So they actually inhibit this step. Means when the proteins and the DNA, they actually join into the new viruses, and ultimately they will not join, and there will be no new virus. These are called actually the HIV protease inhibitors. And with some drugs, that is ritonavir and the ritonavir, they actually prevent viral assembly budding, like this step. If I can explain you earlier here, this step, they actually inhibit this step, means the viral RNA, DNA, or you can say the proteins, they are not combining and they're not making the new virus. It's called actually budding, or you can say that the assembling of the virus, HIV virus. Then we come to the fusion inhibitors, means early inhibitors. It is also cause they are actually cell membrane preventing HIV ability to infect cells. We have some CR5 antagonist. They actually inhibit the formation of a link or a joining between the host cell and the virus, as explained you in this slide as well. If you go here like this, you can say that they actually make a block for this virus to make a contact with the host cell. These are called actually the CCR5 antagonist. And there are some fusion inhibitors, means when the virus come close to the host cell, they actually, you can say that, break this contact. These are called the fusion inhibitors. And then if we see, there are some drugs, integrase inhibitors, means the when the viral DNA, it makes a contact with the host cell DNA, it actually blocks here. This step is the viral DNA, it will not go inside the cell of the DNA of the human cell. It will not hijack the host cell DNA. And I think after that we have some of the drugs which are actually, yes, this is very important that you have to remember that highly active antiretroviral therapy. This is very important. Means either you have the HCV infection, either you have HIV infection. You have to use the drugs in combination, not a single drug. It will not be effective, you can say that. So all HIV patients, they have the combination of treatments. Means these drugs, they have to take in combination. That you can say that this one, like Lamividine, ritonavir, they have to take the drug in combination. Means you will not, if you will use the drugs, if some patients drug they're using as a sole therapy, the single therapy, it will not be that effective. So you have to go for 3 or more antiretroviral drugs at the same time in combination, just to prevent the infection, HIV or the HCV. And then you have to keep viral load below limit of detection and restore immunological function. Means you have to suppress the virus. As I told you that most of the antiviral drugs, they actually lower the virus, they suppress the virus. Yes, random how we choose, means you have to see that either the infection is acute or chronic first, and second, you have to see that the blood chemistry, means either the immune cells are decreasing, either the T cells are decreasing, either you can say that B cells are decreasing. And ultimately, you have to make a combination of the drugs. Ultimately, you have to take the combination of the drugs for the treatment of HCV or the HBV. And then drug holidays. What it means that some, you can say that patients, they take the drug for some time and then ultimately they leave it for some time. Because remember one thing, antiviral drugs, they have some severe adverse effect as well. They have a very severe adverse effect as well, especially in the case of HCV or HIV infection. So please remember that whenever you have to take these drugs, you have to follow the recommendations of the FDA, that what type of drugs you will take and what are the consequences for your patient, side effects, because the side effects, it may be more dangerous for these drugs like HCV or HIV. So all these type of drugs you must have to use in combination, the first thing. Second thing is that you have to use those drugs with cautions, with warnings. And at the end, there is some summary which I have told you all the things, that what are the anti-herpes drugs, hepatitis drugs, drugs against influenza, anti-HCV drugs, and anti-HIV drugs. All this is a summary that we have acyclovir, we have genciclovir, we have interferon alpha, lamivudine. There are some drugs for hepatitis, sofosbuvir, velpatasvir, mentadine, oseltamivir, ritonavir. All these drugs is a summary for you people. And this is all for your session ending. I am so sorry that, please, if you have any question, please let me know. And if you have any question which left, I will give you the answers by my WhatsApp, or sorry, by my email. You can send a question. There was one question, the therapy goals. Therapy goals means for HCV or HIV, that we have to suppress the virus. We have to decrease the virus. As I tell you that a virus, it cannot evacuate your body. You cannot remove the virus from your body. So you have to suppress the virus. You have to decrease the virus. So every time when we have a treatment for HCV or HIV, we have to decrease the virus load or virus number. We cannot remove the virus at all 100%. This is my point. That, and for every therapy goal for HCV and HIV, it is our main theme, or it is our main aim, that we have to decrease the virus load. Everybody is clear? Thank you very much. So nice of you. So if someone could not understand, please let me know by my email. I have my email as well. I can let you know, because the session was for a short time. I can send you my email as well. So you people, I have sent my email, so you can use my email for any question. Thank you very much. Have a good day.